Good afternoon. Today, I will provide a brief update on the Government of Canada's vaccine procurement efforts. From the beginning of this pandemic, our government has committed to protecting the health and safety of Canadians by securing access to safe and effective vaccines. As a result of our diverse portfolio of vaccines and our contracts with Pfizer and Moderna specifically, as of July 27th, Canada has received more than 66 million doses of COVID-19 vaccines. This means that the supply is here for every single eligible person in Canada to be fully vaccinated. This milestone was reached a full 2 months ahead of the original goal of the end of September. And it is a direct result of our aggressive and proactive procurement approach focused on capitalizing on a diverse portfolio of vaccines. Au 27 juillet, le Canada avait reçu plus de 66 millions de doses de vaccins contre le COVID-19. Cela signifie que chaque personne admissible au Canada peut être entièrement vaccinée. Ce jalon a été atteint 2 mois avant l'objectif initial de la fin septembre. Et c'est le résultat direct de notre approche d'approvisionnement agressive et proactive axée sur la création d'un portefeuille de vaccins diversifiés. Far from lagging behind, Canada has been leading the G20 for months when it comes to the percentage of our population with at least one dose, and has led for second doses since the end of July. As of today, we have received over 70 million doses in the country. 82% of eligible Canadians have had at least one dose, and 71% are fully vaccinated. Ce succès est dû aux efforts collectifs de notre gouvernement, des fournisseurs de vaccins, des travailleurs de la santé de première ligne et de tous les Canadiens et Canadiennes qui ont retroussé leurs manches pour faire leur part. Furthermore, our approach throughout the past year is why Canada is in a position to continue to share millions of doses of vaccine with the world. To date, Canada has directly donated more than 30 million doses to the COVAX initiative, and today we are announcing approximately 10 million additional doses from our J&J contract as well. Minister Gould will have more to say on this shortly. This donation is on top of the $2.5 billion in financial support that Canada has committed to international efforts to combat COVID-19. And Canada's support for the developing world will continue. Going forward, our government will maintain a reserve of vaccines of approximately 4 million doses that will be managed by Minister Hajdu and the Public Health Agency of Canada in coordination with the provinces and territories. The purpose of the reserve is to ensure that vaccines are on hand for Canadians when they are needed, while at the same time ensuring that doses are available for other countries. Canadian doses that are identified as surplus will be donated to international partners on an ongoing basis as negotiated and facilitated by Karina and her team at International Development. My team and I at PSPC will continue to work with vaccine suppliers to maintain Canada's supply and to help coordinate deliveries of donated doses to other countries. I would like to thank my Deputy Minister, Bill Matthews, and Associate Deputy Minister, Ariane Reza, and their team for phenomenal work in the vaccine procurement effort. Les doses canadiennes qui sont identifiées comme supplémentaires seront données aux partenaires internationaux sur une base continue.
on an
tel que
ongoing basis
négocié
as
et
negotiated
géré par
and
Karina et
facilitated
son équipe à
by
développement
Karina and her team at
international.
International
Mon
Development.
équipe et moi, à ESPAC,
My
continuerons
team and
de
I
travailler
at
avec les
PSPC
fournisseurs de
will
vaccins
continue to work
pour
with vaccine
maintenir
suppliers to
l'approvisionnement du
maintain
Canada
Canada's
et pour
supply
aider à
and to
coordonner
help
la
coordinate
livraison des
deliveries
doses
of
données
donated
à d'autres
doses to
pays.
other countries.
It is through this approach that our government will continue to ensure that Canadians have the doses we need, while at the same time continuing to be a leader in the international effort to combat COVID-19. In closing, I would like to thank Canadians for their monumental effort in the vaccination campaign. From town to town, city to city, province to province, hockey arena to hockey arena, you have continued to step up to help each other and therefore our country. It is an honor to serve you. Thank you. Miigwech. Merci.
Thank you. We will turn over to Minister Gould.
Great. Thank you so much, Anita. As more and more Canadians receive vaccinations, we are starting to feel a weight lifted from our shoulders. Canadians are stepping up, and they're rolling up their sleeves because they know that with every vaccination, we are one step closer to returning to a more normal life. But around the world, millions are still unvaccinated and unprotected against COVID-19. In low-income countries, only 2% of the population have received one dose. We have a lot of work to do to vaccinate the entire planet. And that is why Canada has mobilized over $2.5 billion in international assistance in response to the pandemic. Canada's contributions to global mechanisms such as the Access to COVID-19 Tools Accelerator, led by our partner, the World Health Organization, will also help get vaccines in arms. And today, I am pleased to announce that Canada will share up to 10 million doses of the Janssen vaccine for distribution to low and middle income countries. The doses were secured through advance purchase agreements. This brings Canada's total donations to the COVAX facility to over 40 million in-kind doses, making Canada one of the leading countries in vaccine donations per capita. We can be proud that 40 million doses is the equivalent to a dose donated from every Canadian to somebody else in the world that also needs to get vaccinated. Nous avons beaucoup de travail à faire pour vacciner la planète entière. Et c'est pourquoi le Canada a mobilisé un peu plus de 2,5 milliards de dollars en assistance internationale en réponse à la pandémie. Les contributions du Canada à des mécanismes mondiaux comme le ACT, dirigé par notre partenaire, l'Organisation mondiale de la santé, aideront également à vacciner les populations plus vulnérables. Et aujourd'hui, j'ai le plaisir d'annoncer que le Canada partagera jusqu'à 10 millions de doses supplémentaires du vaccin de Janssen qui seront distribuées aux pays à revenus faibles et moyens. Ces doses ont été garanties dans le cadre d'un accord d'achat anticipé. Cela porte le total des dons du Canada à COVAX à plus de 40 millions, ce qui fait du Canada l'un des principaux pays en matière de dons de vaccins par habitant. And here, closer to home, our partnership with UNICEF Canada through the Give a Vax matching campaign will help to raise funds to get vaccines safely and quickly to developing countries. The idea is simple. Donate to UNICEF Canada to help the global effort to vaccinate the world. Our government will match your donation. That's double the money. That's simply a great investment. I'm glad to report today that thanks to the generosity of Canadians, UNICEF Canada has already raised over $5 million in this campaign to date. That's awesome. Thank you. Canadians have the opportunity to donate to UNICEF Canada until September 6th. And the easiest way to donate is to send a text with the word vaccines to the number 45678 to donate $10. Je suis heureuse d'annoncer aujourd'hui que grâce à la générosité des Canadiens, UNICEF Canada a, à ce jour, déjà récolté plus de 5 millions de dollars dans le cadre de cette campagne. C'est formidable. Merci. Les Canadiens ont la possibilité de faire un don à
Canadians
UNICEF
have the
Canada
opportunity to
jusqu'au
donate
6
to UNICEF
septembre.
Canada
La
until
façon la
September
plus
6th.
simple de faire un don est
The
d'envoyer une
easiest way to
SMS ou
donate is to
texto
send a
avec le
text
mot
with the word
vaccin au
vaccines
numéro
to the number
45678 et vous
45678
ferez ainsi un don de
to
$10.
donate $10.
As your government, you can be sure that we remain focused on the safety of Canadians here at home, while also playing our part to ensure that the rest of the world has access to safe and effective vaccines. Vaccinating the world is our best chance of ending this pandemic. Together, we can get COVID-19 under control. Thank you. Merci.
We will pass it over
Bonjour.
to Mr. Tam.
Merci. Bonjour à toutes et à tous. Since the last modeling update 2 weeks ago, we have been closely monitoring increases in COVID-19 activity across the country. The latest national surveillance data indicate that a fourth wave is underway in Canada, and that cases are plotting along a strong resurgence trajectory. Nationally, there are now over 13,000 active cases, more than double from 2 weeks ago. On average, over 1,500 new cases are being reported daily, with the majority of new cases reported in the 20 to 39-year age group. After several months of declining severity trends, we're now seeing early signs of increases in severe illnesses following the recent increase in cases. On average, 511 people with COVID-19 are being treated in our hospitals each day, an increase of 12% compared to last week, and 206 people are in intensive care units, which has leveled off. Fortunately, the number of deaths remains low, with an average of 7 deaths being reported daily. Although we're heading into a fourth wave driven by the Delta variant, the good news is that millions of Canadians have rolled up their sleeves to help build a strong wall of vaccination protection. While the Delta variant is more contagious, a complete 2-dose series of COVID-19 vaccines still provides substantial protection. The vast majority of cases and hospitalizations are in those not fully vaccinated. To date, more than 50 million doses of vaccines have been administered in Canada. More than 82% of the eligible population 12 years older have received at least 1 dose. And importantly, over 71% are now fully vaccinated, providing strong protection against symptomatic disease and severe illness. However, there are still millions of eligible people in Canada who have not been vaccinated, and coverage is not even across age groups. In particular, during this last stretch to increase vaccine uptake further across all age groups, we need to build up momentum to increase coverage among young adults, the age group where most of the transmission is occurring. This could help reduce the size of the fourth wave this fall and winter and help limit its impact on our healthcare system. As well, the Public Health Agency of Canada, along with the National Advisory Committee on Immunization and the Chief Medical Officers of Health, are working with experts across the country to closely monitor emerging evidence on the potential need or benefit of a 3rd dose in certain populations, including those who are immunocompromised. For now, our top priority remains ensuring as many people in Canada who are eligible are vaccinated. Together, we have made a lot of progress, and now is not the time to stop. To reduce the risk that this fourth wave could exceed healthcare capacity or negatively impact essential activities like school, we must redouble our efforts to increase the proportion of fully vaccinated Canadians and maintain vigilance with public health advice. Let's make the most of these last weeks of summer and get more people in Canada vaccinated with their 1st and 2nd doses. The more we can vax to the max, the better for back to school. And by getting vaccinated, young adults have the potential to make the biggest impact in building up our firewall of better protection this fall and winter. Thank you. Merci. Megwidge.
Bonjour à toutes et à tous. Depuis la dernière mise à jour de modélisation, il y a 2 semaines,
Since the last
nous avons
modeling update 2
surveillé de
weeks
près
ago,
l'augmentation
we
de
have
la
closely
propagation
monitored
de
the
COVID-19
increase in
partout
the
au
spread of
pays.
COVID-19
Les
throughout the
dernières
country.
données de surveillance nationale
The last
indiquent qu'une
national
quatrième
monitoring
vague
data
est en cours au
indicate
Canada
that
et que le
fourth
nombre
wave
de
is
cas
occurring in
se
Canada
situe le long d'une trajectoire
and that the
de
number
forte
of cases
recrudescence.
is
À
strongly
l'échelle du pays,
increasing
il y
in
a
its
maintenant
trajectory.
plus de 13 000 cas actifs,
There are now more
plus
than
de double
13,000
par
active
rapport
cases,
à il y a 2
more than
semaines.
double
En
compared to 2
moyenne,
weeks ago.
plus de 1500 nouveaux
On
cas sont
average,
signalés chaque jour. La majorité des nouveaux cas
1,500 new
signalés
cases
se
are
trouvant
reported every
dans le
day,
groupe d'âge
with
de
most
20
of
à
them being
39
in
ans.
the 20 to
Après
39 age
plusieurs mois
group.
de tendance à la baisse,
After
quant à la
several months
gravité,
of
nous remarquons
indicators
maintenant les
decreasing,
premiers signes d'un accroissement du nombre de cas
we
graves à
now
la suite de
see the
l'augmentation
first signs of an
récente des cas.
increase in
En
severe
moyenne,
cases.
511
On
personnes atteintes de
average,
la COVID-19 sont
511 people
traitées
with
dans nos hôpitaux
COVID-19 are being
chaque
treated
jour,
in our
une
hospitals every day,
augmentation de 12
an increase
par
of
rapport à la
12%
semaine
compared
dernière.
to last
Et
week.
206 personnes
206
sont aux soins
people, on
intensifs.
average,
Ce
are
nombre
in
s'est
the ICU,
stabilisé.
a number that has
Heureusement, le
stabilized.
nombre de décès demeure
Happily,
faible.
the
Une,
number of
une
deaths
moyenne de
remains
7 décès
stable.
sont signalés
An
quotidiennement.
average of 7
Bien
deaths
que
are
nous
reported
entrons
daily.
une quatrième vague produite par le variant Delta, la bonne nouvelle est
Although
que des
we're in a
millions de
fourth wave
Canadiens
caused by
ont
the Delta
relevé
variant, the
leurs
good
manches
news
pour
is that
aider
millions
à
of
assurer une
Canadians
protection
have gotten the
vaccinale
vaccine in
efficace.
order to
Même
help
si
us
le
reach
variant Delta
vaccine
est plus
protection.
contagieux, une
Although
série
the Delta
complète de
variant is
2
more
doses de
contagious,
vaccin
a
contre le
complete series of 2
COVID-19
doses of
offre toujours
COVID-19
une
vaccines will
protection
still
importante.
offer major
La grande
protection.
majorité des cas et des hospitalisations
The
concernent les
good
personnes
majority of
qui ne
cases and
sont pas complètement
hospitalizations
vaccinées.
are in people
À ce
who have
jour,
not
plus
had
de
their
50
complete
millions de
vaccination
doses de
series.
vaccins ont été
To
administrées au
date,
Canada.
more than
Plus de
50 million vaccine
82 de
doses
la
have been
population
administered.
admissible
More than
de 12 ans
82%
et
of the
plus
eligible
ont reçu
population
au
of
moins
12 and
une
over
dose et
have
plus
received at
important
least one
encore,
dose.
plus de 71
And better still,
sont maintenant pleinement
more than
vaccinés,
71% are now
offrant
fully
une forte
vaccinated,
protection contre la maladie symptomatique
which
et les
offers strong
maladies
protection
graves.
against symptomatic and
Cependant,
serious
les millions
disease.
de Canadiens admissibles
However,
n'ont toujours pas
millions of
été
eligible
vaccinés
Canadians
et
have
la
still not been
couverture n'est
vaccinated,
pas égale dans tous les
and
groupes
vaccine
d'âge.
coverage is not
Plus
equivalent in
précisément,
all age groups.
pendant cette dernière campagne visant à accroître
More
le taux de
specifically,
vaccination dans
during
tous les
this
groupes d'âge,
campaign
nous devons
targeting all
créer
age
une
groups,
dynamique pour
we
augmenter la
need to create a
couverture
dynamic that
chez
will
les jeunes
increase
adultes,
vaccine
le groupe
coverage in
d'âge
young
où il y
adults,
a la plus grande transmission.
which is the age
Cela
group
peut
where
aider
there
à
is the
réduire
highest
la taille
transmission.
de la quatrième vague
That can help
cet
reduce the
automne
severity
et
of the
cet
fourth
hiver
wave
et
this
aider
fall
à
and winter,
limiter son incidence
and help
sur
us to
notre
limit its
système de
impact on our
santé.
health system.
De plus, l'Agence de la santé publique du Canada,
Additionally,
le
the
Comité
Public Health
consultatif
Agency of
national de
Canada,
l'immunisation et les
the
médecins
National
hygiénistes en chef
Advisory
travaillent
Committee on
avec des experts
Immunization,
de partout au pays
and
pour
other
suivre de
groups are
près
working
les
closely
nouvelles
with
données
experts throughout
probantes
the
sur
country
la nécessité
to
ou
group
l'avantage
together more
éventuel
data
de
on the
l'administration d'une troisième
possible
dose chez certaines
necessity or
populations,
advantage
dont les
of
personnes
administering a possible third dose
immunodéprimées.
among some
Pour
groups,
le
such as
moment, notre
immunosuppressed individuals.
priorité absolue demeure
For
de
the
veiller
moment,
à ce que
our
le
key
plus grand
priority
nombre de
is to
Canadiens admissibles
continue
soient
ensuring that the
vaccinés.
greatest number of eligible
Ensemble,
Canadians
nous
get the
avons fait
vaccine.
beaucoup de progrès
Together, we
et ce n'est
have
pas
made
le
great
moment
progress.
d'arrêter.
This is not the time to
Afin
stop.
de réduire le risque que cette quatrième vague ne vienne
In order
envahir la
to reduce
capacité
the risk
de
of having
notre
this
système
fourth
de
wave
santé
overwhelm
ou
our
qu'elle
health
ait des
system,
répercussions négatives sur les activités essentielles
and to
comme
avoid
l'enseignement, nous devons redoubler
having
d'efforts
negative
pour
repercussions on
accroître
essential
la
activities
proportion de
such as
Canadiens
school, we
pleinement
need to
vaccinés
increase the
et
number of
rester
eligible
vigilants
Canadians who are
en ce
fully
qui a trait
vaccinated,
aux
and we must remain vigilant
recommandations en matière de santé publique.
and closely follow public health
Profitons de ces
recommendations.
dernières semaines
Let us take
d'été
advantage of
pour
these
faire
last
en
weeks of
sorte
the
que
summer
davantage de
to
personnes au
ensure that
Canada
more people in
reçoivent
Canada
leur
receive
première
their
et
first and
seconde dose
second
de
doses of
vaccin.
the vaccine.
Plus nous atteindrons une mot-clic vaccination totale,
The more we
meilleure sera la rentrée
#vax
des
to the
classes.
max,
Et
the
en
better
se
the back to
faisant
school season
vacciner,
will be.
les jeunes adultes ont la possibilité de jouer un
Young
rôle
adults can now
décisif
play a
dans
key
l'assurance
role
d'une meilleure
in
protection
ensuring that we
cet
can better
automne et
protect
cet
all
hiver.
Canadians this fall and winter.
Merci. Miigwech.
Thank you.
Thank you.
Miigwech, thank you.
Merci. Nous allons maintenant prendre des questions. We will now proceed with questions from media. Comme d'habitude, ça va être une question et un suivi. As always, it will be one question and one follow-up. I will pass it over to the operator. Opérateur, c'est à vous. Merci.
Thank you. Merci. Please press star 1 at this time if you have a question. S'il vous plaît, appuyez sur étoile 1 maintenant pour poser une question. The first question is is from. La première question est de Tonda McCharles, Toronto Star. Please go ahead. À vous la parole.
Hello, good morning. Given everything that you've just said, Dr. Tam, I'd like to hear from Dr. Tam, and I would like to hear from Minister Anand. How safe would it be to hold an election in Canada now?
Yes, it's Teresa Tam. So I think what we offer is public health guidance to Elections Canada and link them to local public health authorities. As we've seen, we've done many things in society, opened up different spaces and having safety plans in place throughout this pandemic. So there's a lot that's been learned about how to make these kind of voting spaces, if you like, safe. So I think the key advice is really to observe all those good practices, and that would then make safe voting possible, whether it's the social distancing and mask wearing and all of those measures that everyone's pretty used to by now. But you do have to watch the local epidemiology and the local public health advice as well. So that could vary over time. And I believe that Elections Canada has other provisions such as mail-in, which is also a good idea, on top of safe practices at physical locations.
I don't have much to add to Dr. Tam's comments, only to reiterate the importance of following public health guidelines regardless of the situation, and get vax to the max, as Dr. Tam and Dr. New have indicated is so important for our country regardless of the situation. For my part, I will continue to be focused on procurement of vaccines and making sure we have the supplies and the vaccines in place for Canada, for Canadians, as well as to donate, which of course is the subject of our announcement here today. Thank you.
Follow up, Tonda?
Yes, thanks. I guess Dr. Tam and Minister Anand, I'm less referring to the idea of can we all, send in a ballot by mail, or can we show up at a voting booth safely? I mean, I think that you're right, Elections Canada is focused on that. But I guess I'm asking you, Dr. Tam and Minister Anand, in your backyard, Minister Anand, in Ontario, we're seeing cases double. The epidemiologists are very concerned about a campaign. So, Dr. Tam, could you address the specifics of what your expectations are of federal political party leaders in terms of campaigning in these areas? Do you want to see federal party leaders, do you think it's safe for them right now and the entourage that follows them to go in and campaign in regions like where you're seeing this fourth wave resurge? And especially given that many of the participants, the workers and whatnot, are in that age group you referenced. Could you speak to the actual campaigning, and Minister Anand as well, for you, your actual campaign? How do you manage that?
Yes, it's Teresa Tam. I'll start. And there are public health measures that people have to observe, including local measures on gathering sizes, but also best practices in any of those gatherings. Mask wearing being one of them, outdoors being better than indoors. I would say that encourage everybody who is going to show up any gathering should protect themselves maximally, which includes vaccinations. So I think, again, just as other, you're talking about, voting and making that safe. Absolutely. I think anyone who's sort of campaigning must observe those best practices and follow local public health guidance as well. There's different rules being applied in different areas of the country, and you can't exceed the capacity, for example, of some of those gatherings. But regardless of those rules, I would just say layer on as many protective measures personally as you can, which starts with the vaccine, masking, hand hygiene, don't show up if you're sick, all of those things. I do think that the size of the gathering does matter, and how you can control the crowd in terms of their behavior might come into play. You know, there are definitely best practices on how to do that.
I couldn't agree with Dr. Tam more, regardless of whether it is an election, a picnic, a concert, or a sporting event. Public health guidelines must be observed, and that is what we will continue to advocate as a government right across the board until we get to the other side of the pandemic.
Merci. On va prendre la prochaine question, s'il vous plaît.
Thank you. Merci. The next question is from, la prochaine question est de Laurence Martin, Radio-Canada. Please go ahead. À vous la parole.
Oui, bonjour. Ma question est pour la ministre Gould ou la ministre Anand. Un peu pour poursuivre dans la lancée de ma collègue là, en anglais. Bon, là, les rumeurs d'élection se confirment. On parle de le plan, là, c'est un départ dimanche pour normalement un scrutin le 20 septembre. Avec tout ce qu'on voit en ce moment, la montée des cas, là, est-ce que c'est vraiment raisonnable? Parce que c'est votre décision, là, c'est la décision des libéraux de partir. Est-ce que c'est vraiment raisonnable de se lancer en élection?
Is it really reasonable to trigger an election?
Allô?
Hello?
Bonjour, je pourrais confirmer que commencer que ce n'est pas confirmé qu'il va y avoir une élection toujours. Mais comme Dr. Tam a mentionné, on doit suivre dans une élection ou sans une élection des règles des autorités de santé locaux. Et c'est ça qu'on devrait faire comme Canadiens partout au pays.
Mais qu'est-ce que vous répondez en suivi? Qu'est-ce que vous répondez aux Canadiens qui s'inquiètent là, de cette quatrième vague? Puis parce que bon, je comprends que c'est peut-être pas encore confirmé officiellement, mais disons que c'est le plan en ce moment. Qu'est-ce que vous répondez aux Canadiens qui s'inquiètent et qui disent mais ça n'a aucun bon sens de se lancer en élection en ce moment?
Comme j'ai mentionné, ce n'est pas confirmé qu'il y a une élection à ce moment, mais je peux vous rassurer que tout le monde sur le niveau du gouvernement suivent des règles de santé publique. Ça, c'est quelque chose qui est important pour nous et nous suivons des règles des autorités locaux. Même s'il y aurait une élection ou s'il n'y a pas une élection, on va prendre notre guidance pour les autorités de santé publique locaux.
Next question, please.
Thank you. Merci. The next question is from, la prochaine question est de Jean-Paul Tasker, CBC News. Please go ahead. À vous la parole.
Oh, yeah. Hi. Thanks so much for taking our questions. Dr. Tam, this question is for you. Do you support mandatory vaccinations for federal public servants? And if so, can you tell me why that might be a helpful concept now that we're facing a fourth wave?
Well, I think vaccines are, you know, one of the major, you know, strategies for getting through this pandemic. They're effective, they're safe. So that's the public health rationale for, you know, really to get everybody vaccinated. However, we do that in terms of encouragement, making things easier, increasing access. It's up to the public service and, of course, the clerk's been asked to look into that to address this question. The public health rationales are pretty straightforward in terms of the more people that are vaccinated, the more protection is not just for the individual worker, but also for the colleagues that they work with. But some of the federal workers also work with vulnerable populations, including some who are in fact health workers. So all of these aspects will be taken into account as as the clerk and the Treasury Board looks at the actual policy. But yeah, I hope that's helpful, because really is, I think employers, government should look at they know their populations, but anything that they feel is effective in getting more people vaccinated, because that's the bottom line, is doing that. But of course, also be mindful of the fact that some people just can't get the vaccine for medical reasons, for example. So all of those kind of contexts have to be examined.
Yeah, the reason, I asked about mandatory vaccinations is, as you mentioned in your opening remarks, it seems like the vaccine campaign has stalled. We're administering fewer than, I think this morning it was 150,000 second doses each day, less than 30,000 first doses daily, and yet we have as many as 5 million people who are eligible for a shot who haven't yet rolled up their sleeves. Do you think we need perhaps a more heavy-handed approach? Do you think we need vaccine passports for everyday activities? Do we need mandates from more employers and the government, essentially forcing folks to get a shot if they want to move about freely? Is that the best way to close the gap now at this stage? Because, supply is clearly not an issue anymore. The government's been trying the approach of putting advertisements up, and you've been asking people for months to do it, but clearly it's not working enough to really get us to that 90% coverage level that many experts say we need to avoid the worst consequences of a fourth wave. What will it take? Should we get heavy-handed now?
Well, first of all, as you said, I do think we've done remarkably well with vaccine uptake. So just kudos to everyone who rolled up the sleeves, because we must acknowledge that we have been successful to a huge extent. But that last mile, as everybody calls it, is a very difficult one. And I think that's precisely why the Prime Minister has asked for this to be examined thoroughly, and including every policy that is at the disposal of the employer and the federal and Treasury Board and the federal government setting. So I do think that that is being looked at for sure. Both the, as Howard New has said, the carrot, the stick, and everything else in between has to be examined, from all angles. So, I would say just stay tuned on that front, but everything is being looked at.
It's Dr. New. Maybe I could just add to what Dr. Tam said. You're right. If you look at the public health objective, really, is to, get as many eligible Canadians vaccinated as quickly as possible. And I think we've done a remarkable job, as Dr. Tam said. The fact that 82% plus have received at least one dose, it speaks to, I think, the majority of Canadians. Once they have the good scientific information, they appreciate the science, they appreciate the explanation of the risks and benefits of vaccination, and they've come forward to get their first dose. And I think certainly the polls indicate as well that they all plan to get their second dose as well. So it's just a matter of timing for that first group. You're right, though, in terms of the available tools in the toolbox. There are maybe certain parts of the population that where, just the scientific information and sort of the benefits explained both for themselves, but also protecting their family, friends, and co-workers may not resonate. And maybe you need to use, as Dr. Tem says, additional carrots, and that's where you get to the issue of what we call maybe vaccine passports in the provinces and territories, where, additional motivations such as, having certain privileges, being able to attend a sporting event, for example. I just saw in Manitoba the Blue Bombers game. It was very successful in terms of the stadium, having a fully vaccinated individuals, being able to attend that game. So that's sort of an additional sort of a strategy. And then, of course, what you're referring to, the mandatory vaccination, of course, that is, I would say, probably the most, in some ways, you might say, the heavy-handed tool, but that's something I think that needs to be looked at as well. Certainly, the federal workforce is a large workforce. It also interacts with the public, and those individuals are also part of their communities. And so in terms of trying to limit the spread, having them vaccinated, especially if they work with vulnerable populations and frontline sort of occupations, be it nursing and so on, that's very important. But I think it also, sets a tone and maybe sets an example for many other sectors to also say, hey, this is something we all should be taking much more seriously as a country. And I think, that's why I think, as Dr. Tam said, the Prime Minister has asked the clerk to look at it seriously. And those sort of deliberations, discussions are ongoing. But I think that's the underlying principle, that it's, one of many tools. And it's certainly something that needs to be looked at as well, in combination with all of the other tools we have to motivate and get as many Canadians as possible vaccinated. Thank you.
Thanks. We'll take the next question, please.
Thank you. Merci. The next question is from La prochaine question est de Libertium, the Canadian Press. Please go ahead. À vous la parole.
Yes, thank you. I wanted to follow up on the question about the fourth wave and an election. I wanted to ask Minister Anand, obviously, as you said, there's been no confirmation, but I'm wondering personally whether you think that we should go into an election, and if so, why? And I would ask Dr. Tam what your public health advice to the government would be. Would you advise against an election at this point in time, given that we are now in a fourth wave?
Well, Lee, my focus has been and will continue to be to procure vaccines for Canadians and any necessary supplies to fight the pandemic. That's why we procured 2.7 billion items of PPE, 44 million rapid tests, and as you know, we have 66 plus million vaccines in the country at the current time as a result of those procurement efforts. We have more work to do, and I will continue to be focused on working for Canadians, regardless of whether there's an election called or not. Thank you.
It's Teresa Tam, so it's not my role to advise on whether an election should occur or not. I think the role of the Public Health Agency is to provide guidance should an election takes place and how to do that safely. Many things are going on in society right now in terms of daily activities that requires safer approaches we can manage to avoid any impact on our health systems. So that's what I'm watching really carefully. Yeah, so I think our job is to advise on how to do things as safe as possible.
Yeah, it's Dr. Maybe I'll just add to your question, your point. Everyone's talking about the fourth wave, and you can see the fourth wave, and we've both Dr. Tam, myself, in our opening remarks talk about it. The fourth wave is really being driven primarily by individuals who are not vaccinated. If you look at the cases, we didn't give the details, but we can give more details later on, is that it's less than 1% of the cases that have been reported to us that are who are vaccinated. So really, regardless of activities and so on going on in society, it's really a very important issue in terms of still trying to show Canadians that it's so important to get vaccinated with the full course of the 2 doses, because the fourth wave and what's happening now is because of many people still, for whatever reason, not being vaccinated. So far, and it's then again additional proof that the vaccines are so effective in preventing serious illness and death. We're seeing what we call a decoupling, so that the cases might be going up in terms of people getting the virus, but in terms of severe outcomes, you can see that at least so far, the severity indicators are still well within sort of the healthcare system capacity and so on because of vaccination. So we keep underlining the point, get vaccinated. There's still a substantial number of Canadians, in the millions, who haven't even received 1 dose, and we certainly would want to look at encouraging or using other means to have those Canadians hopefully come forward and get vaccinated. So anyway, repeating the point again, but I think it's important to stress. Thank you.
And as a follow-up to that, I was wondering about what statistics, what data we have on breakthrough infections, and if we have comprehensive data already, or whether that is still a work in progress, and as well, if you have a timeline on when you will know whether boosters will be required, or will start being handed out or not.
Yes, it's Teresa Tam. So based on the data provided from the provinces, you've seen some of the graphs, if you like, that was presented at our modeling session that's on the website, and you can get more data from the web updates. But there's very few breakthrough infections after 14 days from the second dose. And when based on the information that we're seeing, those, for example, in hospitalized cases, the last time we did an estimate, which is sort of being updated on an ongoing basis, is definitely less than 1%. It's like 0.7% of those hospitalized are in the fully vaccinated population. And you've seen provinces doing their updates, indicating just the vast majority of people who end up seriously sick and in the ICU are fully vaccinated. So the vaccines are very effective. So as we monitor vaccines over time, I'm looking at, well, after 2 weeks, very few breakthrough cases. Well, what about, 6 months later or further out from that? And we're not seeing any increase or a blip in cases who have been vaccinated many months ago. But it is absolutely something in very active discussion right now, as I've said in the opening remarks by the National Advisory Committee, the Public Health Agency, but all the provinces as well, to amass all of our individual data, to look at the studies that are ongoing. You've probably seen some coming through the media just in the last couple of days, some in Canada, some in the United States. So that is just such an active area of data gathering right now. What we wanted to do was to be thoughtful about this, get as many studies as we can. And we expect that in 2 to 3 weeks time frame, we'll get a bit more information. So we're not just relying on singular studies, and that we have a good basis for those recommendations. I think we will look at the immunocompromised group separately from the general population, and including those who were vaccinated earlier on in the vaccination campaign. So I would say in that kind of a time frame right now.
Thank you. We will take the next question.
Thank you. Merci. The next question is from, la prochaine question est de David Baxter, Global News. Please go ahead. À vous la parole.
Yeah, good afternoon. This question is for Dr. Tam. Just with Canada looking at vaccine passports for international travel, what kind of things are we looking at when it comes to people that may have a mixed vaccine dose, such as Pfizer and Moderna, since some countries aren't going to be recognizing that in their own vaccine regimen?
Yeah, so there's two components, I think. First of all, of course, Canada is going to accept the travelers who have the vaccines on our list for fully vaccinated individuals and in any different combination. So that's one thing, and we're, I would say, leading the world in that kind of policy. And then we're engaging other countries, not surprisingly, some of the European countries who've already gone with a mixed dose approach. And so, because, people, quite frankly, are just working out those requirements right now for international travel, but we are linking with those countries who are fortunate enough, first of all, to have had the vaccine for longer and more populations vaccinated. So, so that is ongoing. And I would just point to also the recommendations of the WHO and their SAGE, that's a committee that's a bit like NACI, but at the WHO level, who's actually looking at this as well. That's really important when it comes to the world accepting mixed doses. And I know that in one of the latest updates, they point to the fact that, under certain circumstances, the mixed schedule might be appropriate. And so all of this is evolving, and I think I just ask for travelers to be patient and to consult what the requirements are of other countries. So we're tackling the question at sort of both ends, coming into Canada, but also country accepting the Canadian approach, if you like, but we're by no means the only country. So we are trying to sort of leverage others as well. And so you may have seen, I think, just in the last week, I believe, a study coming out of Denmark with a vaccine effectiveness for a mixed dose approach. And so all of this is evolving, and countries want to know that kind of data. And so by providing that kind of evidence, we will advance on other countries accepting our successful approach.
Follow up?
Yeah, and sorry, one sec. And just with the vaccine passports on the federal level, just how would they work with the provinces to access that health data that likely would be required, verifying when travelers got their various doses and what dose they specifically got?
Yes, thank you for the question. And I think this is not an area that I lead in, but I do know that there's been some really great meetings and discussions with provinces and territories. I think they're all keen to see Canadians able to travel with a vaccine proof. I do think ArriveCan is a very sort of world-leading solution in terms of people coming back into the country as one of the contributions. But I think all provinces are keen to work with the standards as well as how that credentialing is going to work. As well as, of course, all the arrangements in terms of data sharing as well. So I think that you'll see all of that work carrying on in the next weeks and into the early fall for some of those early updates.
And we will have time for one last question.
Thank you. Merci. The last question is from, la dernière question est de Michael Swan, the Catholic Register. Please go ahead. À vous la parole.
Thank you very much. I wanted to ask Minister Gould, 25%, at least 25% of healthcare in Africa is delivered by the church. In rural Africa, it's over 50%. So I wonder whether the engagement with UNICEF, with the UN system, and large aid donors is bypassing a kind of a trusted and effective route for vaccines to get into more marginalized communities.
Thank you for the question. So I think it should be noted that UNICEF annually delivers about half of the world's vaccines to about half of the world's children. So they have excellent networks with healthcare workers who work locally around the world, including in Africa. And, COVAX is also working with Gavi, or Gavi is managing COVAX, the Global Vaccine Alliance, which again delivers the vast majority of vaccinations to people in rural areas in low and lower middle income countries around the world. So they already have extensive networks with local health providers, and they're using those networks that have been established over decades to deliver the COVID-19 vaccine.
Okay. A follow-up really for Dr. Tam. The WHO has come out very strongly against the idea of rich countries using booster shots, yet you're investigating them. Is Dr. Ghebreyesus wrong when he says it's immoral for rich countries to be talking about boosters when most of the world is unvaccinated?
Yeah, I think, thank you for the question, and it's a very important one. And, to protect Canada, the rest of the world needs the vaccine as well. I think in my, the last media presser, I said that as a small country and with, small groups of people that we're examining right now who might need an additional dose, we can do both. I mean, I think the first group of individuals in Canada, for example, the immunocompromised and others, we're not even talking about booster as much as it is, do they need an additional dose on top of the first 2 doses in order to even mount a reasonable immune response? So those are the questions that we're looking at. At the same time, though, when the National Advisory Committee on Immunization makes recommendations, it's not purely on science. It is also takes into account other considerations, including ethics. You've seen how we prioritize at-risk populations first in Canada when there's a limited supply. So our ethicists are being consulted at the same time as we are making the scientific analysis on that additional dose.
Thank you. That concludes today's press conference. Merci. Ceci met la fin à la conférence de presse aujourd'hui. Bon après-midi.
Bye, everyone.
Bye. Take care. Thank you.
Thanks so much. Bye, everyone.